Welcome to the Uzima Health and Wellness Podcast. What did the doctor say?
So let me ask you this. I want to end with the fact mentorship. Talk to me about, because I believe did I meet one of your mentors in infectious disease?
Yeah, so you met one of my infectious disease mentors, and I actually met her through my San Diego mentor.
The Charmaine, what's her last name?
Yeah, so Captain Charmaine Beckett.
Beckett, okay, so Dr. Beckett.
So she primarily is an East Coast-based, Navy-based infectious disease doctor.
Okay.
That also did research, infectious disease research and clinical practice. But she was really good colleagues with my program director in San Diego.
Okay, because she calls you one of her superstars. Let me just put your plug in. She said he is one of our superstars, so that's nice. So tell me about mentorship and the power of that.
Yeah, so mentorship, it's everything. It's cliche, but like I said earlier, it takes a village. None of us get to where we are by ourselves.
That's right.
We may feel like it, but there's always people there that are kind of like showing you, leading you the path, either by a good example or a bad example. But then if you're fortunate enough to have people that can show you the good example and then kind of give you that guidance along the way. And I was able to have a couple of those. One, Dr. Ryan Maves, he's an infectious disease and critical care specialist. And he's actually the one who kind of steered me towards infectious disease. And, it was on a non-infectious disease rotation. It was actually in ICU.
Okay.
I was like, yeah, but everyone knew him as the ID doctor.
Okay.
He actually became my mentor on a critical care rotation. I was like the senior medicine resident in the ICU. And it's like, we got close through my time there in the ICU, because I thought I wanted to do that at one point, but then I ended up following his footsteps on the other side to do ID.
Oh, wow.
And, it was just one of those things where, he led by example. And I was like, if I can be the type of physician and just person, I want to try to emulate and model that type of behavior.
What's his name again?
Ryan Maves.
Ryan Maves, and he is a Black physician?
No, so he's actually white.
Oh, wonderful. So someone said your mentors don't have to look like you, but they can relate and bring you into their fold. So that's important to know.
Mindset. Exactly.
Yeah.
I did have other, one of my other really good mentors was an African-American doctor, but OB-GYN. So he was good and great from just a Navy medicine. This is what it's like to be a African-American officer in the Navy in an environment where the only other people that you see that look like you, are either Black nurses or they're Black enlisted, but there weren't many Black officer figures.
Right.
So he kind of helped me navigate just being a young Black resident in a predominantly non-Black environment.
Correct.
But I also felt like I got a lot of going to University of Georgia, growing up in South Carolina. I'm like, kind of been groomed towards that my whole life. It's like, okay.
Wanted to be a genetics major, trust and believe you was there by yourself.
For better or for worse, it's like I'd already kind of filtered. I always screen out of being around a lot of African Americans, even from an early, when we had gifted and talented honors. And so the few of us that screened out early on, we already got separated from our Black friends and colleagues. Right. Early on in school, and so that was kind of the norm. And it's interesting because
Hi, Uzima family. If you like what you're seeing and what you're hearing, subscribe to our channel. Hit the bell icon below to be notified of our recent videos. What the doctor say?